Has today reported a record low number of COVID-19 infections from an equally low sample size. In the latest update, there were 22 confirmed COVID-19 patients after a round of testing on 595 samples, which highlights the country's reduced testing capacity. The country's COVID-19 caseload is now over 39,400. 376 recoveries have also been confirmed, raising the total number of recoveries to over 27,000. However, the country has lost 4 more patients to the virus, bringing the total number of deaths from coronavirus to 735. Rose Wangoi reports that despite the fewer number of infections seen, the country must stay on guard.
2 new COVID-19 infections announced today would come as good news if this was based on the true situation on the ground. But with that result coming from a sample size of 595, that is a red alert for the deteriorating capacity for testing and not necessarily a sign of decreasing infections. That's why Kenyans are still being urged not to drop the ball.
We have seen and witnessed Kenyans throwing caution to the wind, perhaps because of initially the anticipated opening up of the economy, and refrain from the calls that draw people to some of these rallies, because those kind of circumstances clearly are very conducive for the transmission of the virus.
So far, 1,029 health workers have been confirmed to be positive for COVID-19, and that the death toll in the sector stands at 16.
Out of this, 526 are males, 503 are females. Our case fatality rate for the healthcare workers still remains very low at 1.6%. Sadly, we have lost 4 patients to the disease.
The Ministry of Health also noted that some counties are experiencing shortage of drugs in the public hospitals. Health Chief Administrative Secretary Dr. Rashid Aman hence urged county governments to clear any pending bills they have with KEMSA to enable the state body supply the hospitals with more drugs.
I have had a conversation with the management of KEMSA, and they assure me that as far as essential drugs are concerned, which they procure and supply to the counties, they have no problem and they have the supplies.
In support for easing the pandemic burden, the U.S. government through USAID donated 200 ventilators to assist the country with its national response to COVID-19.
This donation marks an important milestone in the U.S. government's support for Kenya as we fight the pandemic together.
Work is still ongoing to select the healthcare facilities where USAID will deliver the ventilators.
Rose Wangoi, NTV.